Hello, and welcome to another RPD video. In this video, we'll go over aesthetic options for RPD. There are two main goals in making an RPD aesthetic: hiding the clasp and hiding the flange. We'll go over the various techniques that we can use to achieve those two goals. Let's start with the twin flex clasp. The twin flex clasp is a specialized type of clasp that allows for an aesthetic appearance of the anterior teeth while also maintaining clasp retention. In the image on the left side of the screen, you can see the framework and the twin flex clasps engaging the mesial side of the canines. You may also notice that the twin flex clasp is engaging the undercut from underneath the mesial guide plane. On the right side of the screen is an image of the final RPD in place. As you can see, the teeth in front of the clasp are able to effectively hide it and shield it from view, thereby making it a very aesthetic result. These two images also highlight how a twin flex clasp looks and functions. The image on the left is the tissue side of a metal framework, and you can clearly see the twin flex clasp soldered onto the inside of the framework and extending underneath the proximal plate. The image on the right side of the screen is taken at an angle so that you'd be able to see the twin flex clasp engaging the mesial undercut of a canine. But just to make sure you understand it, we're also going to show an animation of how that framework looks like. As you can see here, if we take that framework and flip it over, you can see that twin flex wrought wire clasp engaging underneath the proximal plate. And if you flip it to the intaglio, you can see it being soldered onto that meshwork on the inside. When the teeth are placed onto the framework, you can see that that clasp tip is hidden from view by the tooth in front of it. Now let's move on to the next option: posterior embrasure clasps. It's often possible to avoid placing clasps in the anterior region where it would be possible by placing embrasure clasps in the posterior region, like this case. This patient had amelogenesis imperfecta and had to lose all her anterior teeth. We're able to avoid having clasps placed on the anterior teeth where it will be visible by placing embrasure clasps on the posterior surveyed crowns. It's important to note that placing embrasure clasps on posterior teeth, especially in the absence of any anterior abutments, predisposes those abutments for early failure. That is due to the excessive forces that these teeth usually have to withstand. In this case here, the patient was informed of the potential risks of having clasps on those posterior teeth. However, they enjoyed the aesthetic results of not having any clasps in the visible region. Another option to hide the clasps is to use attachments. We have a video specifically made for attachments, and I'll leave the video link up here for you to find. We'll move on to the next option: rotational path RPDs. Rotational path RPDs avoid having any clasps in the aesthetic region by having two paths of insertion. The first path is straight up, and the second path is rotational. This allows the RPD to retain itself using the mesial slope of those anterior teeth without the use of any clasps. Rotational RPDs need a lot of planning and require a skilled and experienced lab technician. The last option for hiding the clasp is using implant-assisted RPDs. Locator attachments commonly used to retain overdentures can be used for implant-supported RPDs specifically for retention. It's important to note that support through a rest is still needed on the adjacent tooth. Now let's move on to techniques of hiding the flange. Starting with flange blending. In this case here, you can see a flange on the bottom that's not blended at all, and that's obviously very unaesthetic. On the contrary, in this image here on the top, this flange is barely noticeable. That's because it was very well polished and blended. Another example is this case, where on this side of the flange, the transition is very noticeable, mainly because of the thickness of the flange and how far away from the underlying soft tissue it is. However, if we move on to the other side of the flange, we'll see that this side has been perfectly blended. This is achieved by making sure that the edges of the flange are thin enough to allow some translucency, and by making sure the edges of the flange are close enough to the tissues so as to have no shadows highlighting the transition of the flange to the tissues. Another option to hide the flange is not to have a flange at all. As with tube teeth, tube teeth are cemented directly onto the framework with no pink acrylic resin surrounding them. This allows teeth to appear as if they're coming straight out of the gingiva, which has a very good aesthetic effect. However, to achieve this, the patients would need to have minimum bone loss, which is not usually the case with RPDs. A similar option that also allows for additional customization of the teeth is to use resin-bonded teeth. This allows for composite resin to be added onto the framework, which has these metal beads for retention. When both goals of aesthetic RPDs are achieved, including hiding the clasp and blending the flange, the aesthetic results of RPDs can almost rival fixed restorations, as seen in the picture here. Thank you for watching. We hope this was helpful, and we'll see you in the next RPD video.